Crowns we use when a tooth is either got too big of a filling. There's a limit to how big fillings can be. When they're too big, you can remove cavities with them, but they actually weaken the tooth. Think about when somebody's splitting wood. And what they do is they put a piece of wood and then they put a metal wedge and then they hammer that wedge and they split the wood. Well, here in this case, you've got the metal wedge is, say, maybe an old metal filling. You've got the wood, which is your tooth, and every time you bite down, that's the hammer. Well, over the years, that metal wedge or that big filling puts a lot of stress on the remaining tooth structure. So you have a weak tooth, and one day you go and you bite on that Cracker Jack or whatever's kind of chicken bone, and something breaks. So what we do in those cases is we put crowns on the teeth. Just think of a crown as a helmet that goes over your teeth. That's made out of porcelain and looks natural. And then that way you're able to bite down with confidence and be able to save your tooth. We usually don't like to wait till a tooth is completely broken before we put a crown on it. If we see a problem, we try to point it out and protect the tooth before it breaks. Because sometimes when the tooth breaks, we can't save it and we have to take it out and do more invasive procedures. Now, a bridge is an option when you're missing teeth, which is, with a bridge, you are using the teeth on each side of the tooth that you're missing, and you're basically creating a fake tooth. We call it a pontic, that basically gets attached to two teeth on each side of the space. The advantage to a bridge is that it's a faster procedure as compared to, say, implants, and you're able to sometimes correct for people that have a little more crooked teeth. You'll be able to kind of make them look more straight. Most of the time, an implant is something that I would prefer to do in missing teeth situations. We've been doing bridges traditionally for many years, but now in this day of implants, what I say is if you can keep a one tooth problem, that's always best. With an implant, you're able to, you don't have to touch the adjacent teeth of the space. But some people are not ready for implants. Some people don't have the bone to be able to put an implant in, and they don't want to go through the what we call bone augmentation to be able to get implants. And in those cases, especially on anterior in the front of the mouth, sometimes doing a bridge is a better option for the patient. So those are all kind of things that we can talk about, and I can kind of guide you to help make a better decision and the best decision for your mouth.